I'm Alexander Casall. I'm working at Zeiss Digital Innovation. We support medtechs in transforming their product portfolio in a more future-oriented way, so to say. And here we have a lot of insights on the topic of interoperability, which I would like to share today. So.
Great, thanks.
Murielle and McLane. So I manage Intuitive Ventures. We are a strategic corporate venture fund with $250 million in asset under management, and are keenly interested in investing in the ecosystem, helping really enable access to minimal invasive care, and interoperability is a big deal for that matter. So excited to talk about it.
Super cool, thanks.
And I'm Thibault. I work for AXA, one of the largest health insurance company in the world. And the main interest we have in interoperability is that it's a means to fight against the medical cost inflation that's coming up everywhere. So we see that as a very important tool for the future.
Absolutely. Okay, so let's start with Alexander. So from the point of view of MedTech, what is, how interoperability is playing a role?
So I would like to start maybe with a short definition, what we see under the term interoperability, and we see interoperability as the ability of systems or organizations at the end to interact with each other while reducing the effort for the user. And by this definition, you see already that reduction of effort is really in the center of interoperability for us. And in our case, from MedTech's perspective, it could be a reduction of effort for the provider, for example, to install a medical device in the infrastructure. But it can also be the effort for doctors or technical staff to use the medical devices in workflows or at a workplace integrated with other medical devices. And looking on some examples, so if you, for example, take ophthalmology, where Zeiss is more involved, but also other fields like radiology, sorry.
Anem amb retard, em diuen.
Okay.
Radiology
as a other field, both specialties are imaging savvy, so to say, and are following a certain workflow logic. Means, for example, a patient gets registered, images are acquired, diagnoses are conducted, maybe a treatment, a procedure is planned, like a surgery. So there's a certain workflow logic, and I missed definitely some workflow steps. But here in this examples, also interoperability standards, like technical interoperability standards. This is also really important for medtechs. Technical interoperability standards come into the game, so to say, to enable to have the systems which are involved in this workflow to talk to each other, right? And as this is really imaging savvy, there is one standard which is pretty mature, I would say almost commodity, like DICOM. I think everybody knows that. And DICOM enables at the end imaging modalities, but also systems to interchange data, imaging data. As this example is a bit commodity, I would like also to outline one field where I see more dynamic, or we see more dynamic in the field of medtechs, which is interoperability in the area of point of care. So really looking to the operating room, or for example in the ICU setting. And also their standards are evolving, like technical standards, which are pretty important for the medical device manufacturers to implement them. And there's one standard which is called SDC, Service-Oriented Device Connectivity. It was initiated some time ago by Dräger, a German medtech company, and also got picked up by other big players like Philips and so on. And what this can, for example, achieve or support, I would like to give one example from the ICU setting. Imagine you are in an ICU at a patient's bed, and around the patient bed there are a lot of devices like patient monitors or ventilators or pumps. And what you will recognize if you go into an ICU, that there is a certain high noise level, because all of those devices are sending alarms. Even if there is no critical situation, but there is a lot of beeping and a lot of noise. And this noise is bad because on one hand for the patient's recovery, because he hears all the time the voice, and on the other hand for the medical staff, an effect which is called alarm fatigue can occur. Means that because you always hear alarms, you do not realize if there's a real alarm and you need to interact. And SDC, for example, enables or would enable medical devices, also cross-vendor, to delegate alarming to another medical device, for example, to a patient monitor. And this, at the end, allows to consolidate alarming in the ICU setting. Means it reduces the noise level, which is good for the patient, but also for the medical staff, which I outlined already. And to conclude, I would say, one part from medtech perspective on interoperability is really the increased effort to achieve certain things from the user's perspective. Second thing is really technical standards are really important. And third thing is there are, I would say, areas which are more mature and where interoperability is already, so to say, commodity, like the DICOM example. There are areas which are, I would say, evolving, maybe more in the field of fire. And there are really new fields also, like this SCC example at the point of care.
Wonderful. Yeah, there is nothing worse than starting looking for where an alarm is coming to be slow in reacting. Okay, Murielle, so from your investment perspective, so what are the most interesting areas for investors in the interoperability and connected care space?
Yeah, so I'll kind of echo a little bit of what Alexander was talking about. So you heard a lot about infrastructure. You heard a lot about standards that are emerging. So the parts that really, really excite us is how do we help build those standards, right? Cybersecurity becomes really, really important when you think about interoperability. So this is an area, for instance, where we made an investment in a company that really helps med devices manufacturers get their product up to standard for the FDA and as well monitor it going forward. As soon as you start talking about interoperability, you also talk about cloud, data infrastructure, all areas really, really important to have, and obviously med devices and life science companies have different needs than, let's say, a traditional SaaS software company. So we're looking at that space as well. And then tools. DICOM is a great example of what are those types of APIs that are out there that enable patient longitudinal data in a GPDR environment. So again, an area where we have made a bet in the imaging space and looking at videos as well, where you, by plugging, those plug and play allow you to look at patient longitudinal data across health systems so you can start to see really the 360 of the patient. So there are a lot of exciting new companies that are startups in that space. Obviously, there's also what does that interoperability allow, right? So a lot of it, that data collection allows for better patient care through better analytics, model better decision support tools in and outside the wall of the hospital. So from a quality perspective, we're looking at how can we enhance the patient experience, how can we reduce the length of stay, how can we help elevate the high-risk patients so that you, Federico, can actually put the right attention to those patients as they continue on the journey post-surgery. So we're quite excited about what this creates. Now, this is not a new field. We were having a sidebar discussion earlier, and I've been talking about FHIR, about HL7 for now, I don't know, 8 years. So it's evolving, but it's evolving slowly. So the last thing I would mention is business models matter. So as we look at in those areas of investment, we really think about how long will it take you to deploy, what's the TAM, SAM, SOM, and can we get to an exit scenario that makes sense for us as an investor?
Absolutely. Very interesting. So at the end of the day, patient satisfaction is the measure for success of a company. So it is at the end of the day, what's interesting for investors to look for.
Patient satisfaction, but frankly, patient outcome, more importantly.
Mm-hmm.
Reduced cost of care, which I'm sure you'll hear a lot from Thibault around that, but that's really important to us as well.
Cool. So Thibault, now the insurance point of view. So seeing this shrinkage in the number of doctors available, that most probably we're gonna get even more severe in the future, a lot of attention has been growing on primary care. So what is your point of view on primary care? What are you doing as insurances in this field, and how interoperability works in that?
Sure. So perfect transition, Murielle. Thank you very much. So for health insurance companies, one of the major challenges is the medical cost inflation, which I'm sure you've all heard about. So health insurance companies reflect the medical cost inflation into the premium. So a lot of health insurance companies, of which AXA, are trying to fight against this medical inflation. And we're taking the steps to drive better patient outcome. But we can't go that far, right? Because we're a payer. So what we're doing is moving into this interoperability space to drive more seamless pathways for patients, to drive more adoption of digital health solutions, to drive a better triage, and ultimately help with the capacity issue that you're referring to. That's our contribution to this. Of course, we'd like to do more than that. That wasn't your question, but that will be my answer. The reality is that as a payer, when we do interoperability at primary care, what we're trying to do fundamentally is reduce the volume of patients going to clinics and hospitals. So when we work an ecosystem with caregivers, this aligned incentive, this trust is being built, but it's not there yet. And I will echo what you said. It will take a lot of time before all of the actors of a healthcare pathway are aligned and can build a proper interoperability system, not from a technical standpoint, but from a trust issue, I feel.
Of course. So you are basically using technology to ameliorate the gatekeeping role of primary care in order to make everything more sustainable.
The triage and drive the effectiveness, the outcome. Yeah. But to drive outcome, I mean, as stupid as it may sound, but you need to have data points. You need to be able to demonstrate that this or that pathway is more efficient. And this sharing of information, this granular sharing of information, doesn't always go to the same direction. That's what I'm trying to say.
And what about these new technologies like connected care or telemedicine? How are they changing your reimbursement models?
So before COVID, a lot of health insurance companies, not only AXA, actually some competitors have been better than us, way better than us, have incorporated access to symptom checkers, chat exchanges, teleconsultation, connected to maybe labs or even drug deliveries, right? So this is already incorporated in a lot of the plans. Of course, it accelerated during the COVID, post-COVID spike of adoption, and now health insurance companies are rationalizing this. But it's incorporated into the benefits, I think, today.
Cool.
For sure.
Thanks. Alexander, so you're continuing pushing innovation as a company and in general as a field. So nowadays, of course, the hot topic is the introduction of artificial intelligence and generative artificial intelligence in the field. So how do you have a comment on that? How does interoperability enables AI introduction in healthcare?
Yeah. So I would raise the question, what is the most important thing talking about AI? So it is data, right? You need data to train AI models. You need data at the end to do really the inference, really do conclusions, so to say, out of data, to do decision support, for example, then really when it comes then to use cases. And if we talk about data, it's data from different modalities, from different systems in the hospital, also the topic of how the data is structured, not only that you can access data, but what is the content of the data, what is the semantics, and so on. And I think this is also a big challenge in healthcare because the data quality is often not good. So, and all those things are addressed by interoperability, right? You have these technical standards which are giving a semantic structure, also a syntactic structure. You have the connectivity part that systems can talk to each other. So basically it's a foundation for AI, so to say, in the field of healthcare from different perspectives. So I would wrap it up as interoperability is an enabler to scale AI, to not having AI in a local, maybe one hospital setting, but really to scale it over different hospitals and then over different markets at the end also.
Super. And to conclude, Murielle, how do you see the connected care in 2-3 years?
I don't have a crystal ball, unfortunately.
Yeah, please tell me.
That's pity.
So I'm not sure. I think we're getting better. And we definitely see how being able to connect the EHR to the DICOM to some of the diagnostics results help. Are we going to be where we would like to be, where everything is fully connected from entry for a patient identification all the way to treatment and then post-care? I think we're still very far from that, unfortunately, and it has to do not only about technology, but about regulation and trust, as Thibault was mentioning before.
Super. Yeah. So what I bring home as a healthcare provider is that it's nice to see that the whole pipeline, the whole industry, is aligned toward outcome, basically. So it's not just a matter of driving technology, which is good fun for everybody, but is a matter of building a very data complete and workable ecospace for everybody, so that at the end of the day, who gains, the more is patients. Okay, thanks a lot again for your time. And